At a media briefing, Stefan Chioro says the growth in healthcare costs over recent years is of concern to the medical aid fund industry, as the Namibian medical aid fund industry is under severe financial pressure to the extent that the combined reserve levels of all medical funds have breached the prudential reserve limit of 25% of the gross annual contribution. The combined reserve levels now stand at 23.83%, below the statutory requirement.
Because medical aid funds have been running operating losses and funding their deficit from their reserves, the ideal ratio for funds is that 85% should be spent on healthcare costs and claims, while 10% is on administrative expenses, which is also known as non-healthcare expenditure, and 5% towards reserves and investments.
He says the effect of the situation is that to bring normality, medical aid funds would be required to implement very high contribution increases for 2024. This increase is to rebuild a reserve of about 3% per annum.
The above translates into a required contribution increase of between 13 and 15% for 2024. Given the high cost of living and pressure on disposable household income, these increases are not sustainable or cannot be attained.
The current financial position, NAMAF says, requires the medical aid funds and other stakeholders to collaborate to find common solutions and avoid casting aspersions at each other. There has been a historical fight between NAMAF and Namibia Private Practitioners Fund over the latter's benchmark tariffs. The tariffs set guideline charges for doctors and other medical providers to follow. Jelana Fuka, NBC News, Bantuk.